Good morning, everyone. I'm Karen Middleton, Executive Director of NARAL Pro-Choice Colorado. And we are here today to really thank Senator Udall for introducing a bill that is designed to really combat what we feel is an incorrect and really unfair decision around the Hobby Lobby case. We think bosses need to be out of birth control decisions. We know that we did not have a favorable opinion last week, and we're going to go ahead and work hard to change that. And I'm joined today with Vicki Coward, who's the CEO of Planned Parenthood of the Rocky Mountains, and we think this is just a very important decision. We think it's affecting women, families, and folks all over the country, and we are just delighted to be here today and want to thank you for taking the time to join us.
Let me add my thanks to the Senator and also Congresswoman DeGette. Planned Parenthood of the Rocky Mountains serves over 100,000 women across a 4-state region, and what we have seen is that now that women have birth control covered by their insurance, they are able to choose the right method for their lives, for themselves, and actually reducing the amount of unintended pregnancy. This is a very important health issue. Nearly 99% of all American women use birth control at some point in their lives, and up to 60% of them use it for medical reasons. So we are talking about meaningful health care here that has been taken out of the range or out of the reach of a lot of working women as a result of this bad Supreme Court decision. And I want to thank the Senator for taking the strong stand and doing this so quickly. This is an important issue. So thanks for understanding what women are going through and being a part of this solution.
Thank you, Vicki. As you can imagine, I'm honored and proud to stand here with leaders from the Colorado reproductive health community. And I want to emphasize and underline that as they have, as Vicki and Karen have, that the Supreme Court's decision to allow some employers to refuse to cover contraception as a part of an employee's health insurance policy was wrong, and it was misguided. Coloradans understand that women should never have to ask their bosses for a permission slip to access common forms of birth control or other critical health services. The men and women who went to work for Hobby Lobby signed up to work at a craft store, not a religious organization. And with up to 90% of American companies considered closely held, the Hobby Lobby decision means that millions of working Americans' access to critical health care services may be threatened. These corporations employ about half of all American workers. That means that half of our bosses now can pick and choose which contraception and other health care services are best for our families. The legislation that I've introduced along with Senator Murray from Washington, which we call Not Your Boss's Business Act, will restore a woman's power to make personal health care decisions based on what's best for her and her family, not according to her employer's personal beliefs. The bill will also level the economic playing field for women. The Supreme Court's decision unfairly burdens hardworking women, ignoring the plain fact that contraception can be crucial to women and families' economic success and their right to live life on their own timelines and their own terms. And finally, contrary to what supporters of the decision are saying, this isn't just about contraceptives. The Supreme Court's Hobby Lobby decision could lead to employers discriminating against women, minorities, and any other groups that need particular types of medications or procedures, such as vaccinations or HIV treatment. In a span of 2 weeks, we have seen Justice Ginsburg's warning play out about the unintended consequences of the Hobby Lobby decision, from the court's decision to expand the ruling to all 20 forms of birth control, to the Wheaton College case and concerns about the Employment Non-Discrimination Act, which seeks to protect gay, lesbian, and transgendered Americans from workplace discrimination. That's why we must take the steps now to push back and ensure that we can all make our own health care decisions without corporate influence. I'm going to keep fighting to ensure that women have access to affordable birth control and are not forced to pay out of pocket for medical services that they've already paid for as a part of their insurance and work compensation. We are committed to changing this Supreme Court decision, and we're committed to showing that women's health care is not your boss's business. Again, I want to thank everybody for joining us today. And it's my real privilege to introduce Christina Aguilar from Color. Christina.
Thank you, Senator. Good morning. My name is Christina Aguilar, and I am the Executive Director of Color, the Colorado Organization for Latina Opportunity and Reproductive Rights. We are Colorado's only reproductive justice organization, and we advocate, educate, and organize Latinas, their families, and our community around reproductive rights and social justice issues. We believe strongly that healthcare is a human right and that private corporations should not be allowed to discriminate against women in the guise of religious freedom. I stand proudly with our partners and legislators here today, including our own Senator Udall, in support of the Protect Women's Health from Corporate Interference Act, also known as the Not My Boss's Business Act. I am thrilled to see this federal response to the Supreme Court's ruling on Hobby Lobby. That decision set a dangerous precedent, which is why this act is so important and urgent. The recent ruling effectively invited corporations into women's reproductive health care decisions. These are decisions that we know are best left to a woman and her family, as they know what is best for their health and lives. Sadly, the recent decision sent the message that the nearly 5 million Latinas who have already benefited from the ACA's contraceptive benefit are entitled to less religious liberty than big corporations. Like my colleagues, I'm deeply disappointed in the recent decision, particularly because it deals a serious blow to both religious liberty and Latina health. We know that overwhelmingly the majority of Latinas, including 90% of married Catholic Latinas and other Latinas of faith, use contraception to help plan and prevent their pregnancies. Contraceptive coverage isn't controversial, it's common sense. And thanks to the ACA's contraceptive benefit, millions of Latinas have been able to plan pregnancies at no additional cost. Over the years, we've heard from our community that the cost of prescription contraception was too high. In fact, many young Latinas are more likely than any other group to skip taking prescription contraception because they simply can't afford it. We know that our families and communities are stronger and healthier when Latinas can plan the timing and spacing of our children. As the Protect Women's Health from Corporate Interference Act clearly illustrates, our work continues and our fight continues. We urge Congress to pass this act and to protect women's right to access reproductive health care, regardless of where she lives or works, her income, or her immigration status. I thank you for your time this morning, and I would like to introduce Dr. Heyer, who will close with a few additional remarks.
Hello, I'm Dr. Jennifer Heyer. I'm an OBGYN. I work in Denver. Board certified. I have medical license in good standing, and I work with the underserved women in our city. I'm here representing myself and NARAL Pro-Choice Colorado. My number one concern with the Supreme Court's decision in the Hobby Lobby case, and the reason we need to fix it, is that it interferes with the doctor-patient relationship. Senator Udall's bill will help ensure that the doctor-patient relationship remains intact and women can make their own healthcare choices. As a physician and an OBGYN, I need to make recommendations that are in the best interest of my patient, without an employer or a politician looking over my shoulder. This includes recommendations on the best type of birth control. As someone who's treated patients with high-risk pregnancies and complicated medical conditions, I know that birth control is a very necessary discussion for women's health. Deciding if and when to have children has an enormous impact on a woman's physical and emotional well-being. In regards to birth control, every woman is different. Some women use the pill. Some women are better suited for an IUD or a longer acting form of birth control, which can prevent pregnancy for up to 10 years. And none of these conversations are anyone's business but the woman herself in consultation with her physician. As a physician, the Hobby Lobby decision ties my hands and puts me in an impossible situation. Do I recommend the birth control best suited to the individual woman, or the one her boss will approve and therefore she can afford? Physicians have to exercise their medical training and their judgment to make decisions that are in the best interest of their patients. I love my job, and I consider it a privilege to be a physician. It shouldn't be the role of politicians or employers to tell me and my patients what kind of procedures I should use or what kind of medicine I should practice. Senator Udall's bill will help ensure that women have the freedom to make their own health care decisions in consultation with their own doctor. I thank him for introducing it, and I urge all of our Colorado senators and representatives to support it. Thank you.